And I'll go ahead and introduce our speaker, Dr. Laurie Dohmen. Dr. Dohmen has received training in acupuncture, food therapy, Bach flower essences, and most extensively Western herbs. She has received her Master's of Therapeutic Herbalism from Maryland University of Integrative Health in 2014. She downsized her integrative mixed animal practice in Delaware and now lectures regularly on Western herbal veterinary medicine and other holistic topics. She started an education company, Purple Moon Herbs and Studies. She has a hands-on course in Western veterinary herbal medicine. Dr. Dohmen is the past president of the Veterinary Botanical Medical Association and a member of American Herbalist Guild, International Veterinary Acupuncture Society, American Academy of Veterinary Acupuncture, American Holistic VMA, AVMA, and Delaware VMA. She is on the editorial board for the AHVMA Journal. Dr. Dohmen lives on a 72-acre farm with her husband, 2 sons, many 4-legged animals, and organic herb and vegetable gardens. Dr. Dohmen.
Thank you. Hi, everyone. Thanks for staying till the end of the day. I know it's a long day, especially the first day. But I'm excited to be talking to you guys about bee medicine, and we're going to talk about a bunch of different properties from bees. So this quote was in one of the articles I read on bees. "My deep respect and my deep thanks for our God for giving us the honeybees." And I think that's a really beautiful quote and really sums it up. I think bees are critical to our lives, and this is just another way that they can enhance and support our lives, and on top of all the things they already do, like pollinate our food, which is kind of basic. So I'd also like to thank my oldest son, who has been, since he was 9, the youngest beekeeper in the state of Delaware, for making me become interested in bees and bee medicine and everything about bees. And he did help me quite a bit with this talk. So this picture right here is one of my sunflowers and one of his honeybees. So this is another one of his honeybees that landed on my foot. I know it's a little blurry. I blew it up, but it landed on my foot one day. They're very friendly, and if you're not afraid of them, they just kind of coexist with you, as we should all do together, in my opinion. So honeybee is a specific species of bee capable of producing honey. Seems kind of obvious, but bumblebees and carpenter bees and things like that don't actually make honey. Apis mellifera is the species that makes honey that we eat. So, the queen is the bee who runs the hive and is the fertile female. She's the only fertile female in the hive. The drones are the male bees who exist just to mate with the queen, that is her harem. The worker bees are all the sterile female bees who travel to collect pollen, produce honey, and brood. And I just saw a slide like the worker bees, the sterile females, every stage of their life, they do something different. Like days 1 through 3, they do one thing, and 2 and 3 through 6, they do something else, and they graduate. And it's the last phases of their life, the last 2 weeks of their lives, that they go out and actually collect pollen and honey. So for that, they're working in the hive. Brood is bee food. The beehive is their home, the community of bees that live together. And the honeycomb is actually the structure of the beehive, the actual house, as it were. And when bees swarm, it's when there's 2 queens in a hive and one of them takes a group of workers and leaves to create a new hive. It's a very important and natural part. So when we see them swarm, everybody's like, oh my gosh, the bees are swarming. It's actually a good thing. It means that there are 2 queens and one of them is leaving to start her own house, which is as it should be. So. A few more definitions. Apiculture is the science and art of prolonging, sustaining, and retaining health by use of products obtained from honeybee hives. So that's what we're going to be talking about today. And these are my son's hives, 3 of them. Functional foods, which are also called nutraceuticals, are foods that has the ability to promote better physiological or psychological health compared to traditional remediated and nutritional foods. So all these products that I'm going to talk about today that are used for ingestion, that are used orally, are considered functional foods. So that'll come up in some of the research I'm going to talk about. I do have some samples of some stuff to pass around, some of the bee products, not all of them, just the ones that were accessible in my son's hive last week, and honey that I took this morning from, I figured everybody knew what honey was, but I grabbed a honey because they had these sweet little honeys out by the tea and coffee this morning. So this is thanks to the Gaylord. Honey is a liquid the bees produce to provide the hive with food over the winter. So the bees actually produce that for themselves to eat over the winter. A lot of people, beekeepers, will take the honey, of course, because we want it, but then you have to supplement your hive with sugar water or something else. So like my son feels that it is their food first, and he will only take the honey out if there's enough for us and for them. So we eat last on his food chain. Bee pollen is plant pollen collected by the bees, then supplemented with a mysterious bee substance. It's not really mysterious, it's just scientists haven't figured out what it is yet. The bees know exactly what it is, it's not at all mysterious to them. Bee bread, which we are not going to talk about medicinally today, but I'd just like to go through all the bee products. It refers to pollen stored by the bees in their combs. The bee bread is further processed than the pollen for storage with the addition of various enzymes and honey, and then it subsequently ferments. So you can see it looks very similar to the pollen, but slightly different. So. Propolis is also known as bee glue. It is a resinous substance that the bees accumulate from plants. The term comes from pro, which is Greek for at the front of, and polis, which is city. So it's the defense of the hive or the front of the hive. It's what they use to fix the hive for repair. Royal jelly, which unfortunately we couldn't get any of because the queen cells that my son had eaten all their royal jelly. So there was none in them. We checked a couple. But it is a substance secreted by the hypopharyngeal and mandibular glands of the young worker bees. And then beeswax, again, I didn't bring any of this, but it is synthesized in 8 wax glands that produce and secrete wax platelets. These platelets are chewed into pliable pieces with the addition of saliva and a variety of enzymes. Once chewed, attached to the comb, and rechewed several times, they finally form the comb. Beeswax is also used to cap honey, protect the brood, which again is the food, and as a sealant in the hive. Lastly, bee venom is a secretion produced by the stinging apparatus of the bee. And I think this is just the most amazing picture of the actual stinging apparatus separating from the bee, which of course is unfortunately fatal to the bee when they leave that part of their body behind. So let's talk about these products. Honey is produced from the nectar of flowers. The nectar is first collected from the flowers and undergoes ripening by partial enzymatic digestion in the honey stomach of the honeybee. The ripened nectar is then matured by moisture evaporation through fanning by the bees. So they dehydrate it. It has been used worldwide throughout history as food and medicine in ancient Egypt, Greece, China, Rome, and more. It is pictured on a Stone Age painting from 8,000 years ago, as well as on a Sumerian tablet from 6,200 years ago. Honey is mentioned in most religious texts, including the Quran, the Bible, and the Hindi Veda. It is over 80% carbohydrates, but it also has water, protein, vitamins, minerals, and other components in small quantities. The main 2 sugar carbohydrates are fructose and glucose, and the active phytochemicals include flavonoids, polyphenols, and organic acids. And both flavonoids and polyphenols are antioxidant. So honey has many medicinal actions, including it's gastroprotective, anti-inflammatory, vulnerary, which means it's healing to the skin, cardioprotective, antioxidant, anti-diabetic, antibacterial, antifungal, and anti-cancer. Honey is used internally and topically for a myriad of conditions, including wounds, which I think most of us are familiar with at this point, It's also good for gastrointestinal diseases, oral and upper airway disorders, liver disease, pancreatic disorders, metabolic disorders, ocular ailments, cardiovascular diseases, neurologic disorders, and cancer. This functional food term comes up again. It is a quickly and easily digestible source of energy for the body. It also functions as a prebiotic and a preservative for other foods. Honey lasts forever. It does not go bad. It's got its own antibacterial and antifungal and everything else. So it is a preservative because it is a sterile kind of food. It does have contraindications, including toxicity from plant sources or chemically treated plant sources. You know, again, it's very concentrated plant sources. So if the plants that they're eating are treated with Roundup or something else horrible, then it's going to have a lot more of that in it concentrated than if you ate the plant even. It also can contain Clostridium botulinum. I think most of us know that in sufficient amounts to kill very young, which is why it's contraindicated in humans under 1. And it can occasionally cause allergic reactions in people who have pollen allergies. And the flavor of the honey does depend on the nectar and what plants it was collected from. So I think we've all seen that, all the different color honeys and things like that. And this is just a slide of what I just said, all the biological activities of honey. And we're going to talk about a few of them. I had to kind of pick and choose my favorites for each bee topic because we'd be here for 3 days if I talked about all of them. So. Honey has been known since ancient times as an agent that is able to encourage the repair of wounds, guaranteeing healing with little or no scar formation. Honey is an effective treatment of wounds because it is non-irritating, non-toxic, self-sterile, bactericidal, nutritive, easily applied, and more comfortable than other dressings. Like when you peel it off, it doesn't stick like other dressings. I don't know if anybody noticed, but there's a honey company down in the exhibitor hall this year selling medicinal honey. I haven't seen them, talk to them yet, but there is somebody who's processing it in some medicinal way. So go check them out and see what you think. Again, I haven't been there yet, so I'm not commenting on them in any positive or negative way, just saying that's the first time I've ever seen. You know, they're starting to market it. I've seen it in the human world that people aren't just using honey, they're using medicinal, and I'm not talking about the melaleuca and all of that, but they're formulating it for medicinal use. I don't really know what that means because to me it's honey, but anyway, go check them out. I plan to. So. The skin healing ability of honey has been attributed to its antimicrobial properties, its ability to modulate the skin's immune system, and promote tissue repair. Many strains of honey have been proven to kill a variety of common wound pathogens and sterilize a wound in 7 to 10 days. Some of the pathogens studied include MRSA, various staph species, E. coli, various Pseudomonas species, various Salmonella species, Enterobacter, Klebsiella. It also prevents and removes biofilms, gram-positive and gram-negative bacteria, and aerobic and anaerobic bacteria. So it's a very broad spectrum, bactericidal and bacteriostatic. The immune modulation, it stimulates cytokine production by keratinocytes and monocytes. It downregulates the production of MMPs and ROIs, which are matrix metalloproteinases and reactive oxygen intermediates. These contribute to excess inflammation. It enhances tissue repair and reduces chronic inflammation. Honey promotes reepithelialization and angiogenesis via activation of pathways that regulate cell locomotion and proliferation. It provides a moist environment and a protective barrier, in part due to its viscosity. And the therapeutic effects observed after honey application include fast healing, wound cleansing, clearance of infection, tissue regeneration, minimized inflammation, increased comfort during dressing due to lower extent of tissue adhesion, It stimulates new capillary growth, new fibroblasts to replace the connective tissue in the deep skin layers, new epithelial cell growth, and the moist environment allows autolytic debridement and protective barrier that prevents the bacteria invasion on top of it being bactericidal. So that's how it's working. For gastrointestinal disease, it helps to repair the damaged intestinal mucosa, stimulates the growth of new tissues, and works as an anti-inflammatory agent. Honey has bactericidal against most enteropathogenic bacteria, including E. coli, Salmonella species, Shigella species. It stops Salmonella from attaching to mucosal epithelial cells. Kind of like in the last hour, we were talking about how cranberries stop E. coli from adhering to the bladder lining. Honey stops Salmonella from attaching to mucosal epithelial cells. In diarrhea, the sugar in honey promotes the resorption of sodium and water in the GIT. In ulcers, it is bactericidal against Helicobacter pylori. It reduces the secretion of gastric acid and protects against gastric damage. It is used to treat dyspepsia and GERD. In GERD, honey coats the esophagus and stomach linings and actually regrows the sphincter tissues. It can be added to oral rehydration solutions, and they do this for children because the sweetness is very appealing to them. Obviously not children under 1, but your 1.5-year-olds to adulthood. The sugars in the honey are easily absorbed, and there are all these other nutrients in the honey, so it's, again, a functional food that they can take orally, as well as making oral rehydration more palatable for them. And it contains prebiotics that increase probiotic numbers. It contains inulin and lactobacillus species. Cancer. This big, huge picture talks about all the way it works for cancer on a biochemical level. We'll just go over some of the bigger points. Honey proved to be moderately effective against tumors and significantly effective against metastatic growth. The mechanism of action includes mainly its interference with multiple molecular targets and cell stimulating pathways. Mechanism of action includes induction of apoptosis. Phenols induce apoptosis via activation of the capsase cascade, induction of P3, and upregulation of pro-apoptotic proteins. I could do a whole talk just on how it works for cancer, so this is going to be a quick overview. It's anti-proliferation. It causes cell cycle arrest. The anti-inflammatory actions are via the attenuation of pro-inflammatory mediators, inhibition of NF-kappa B and MAPK signaling pathways, and due to the phenols and flavonoids. It's anti-mutagenic. It has mitochondrial membrane depolarization and activation of the mitochondrial pathway. The flavonoids and phenols, again, affect the mitochondria. It inhibits angiogenesis. So in the last slide, or 2 slides ago, when I talked about wound healing, it enhances angiogenesis. Here, it is inhibiting angiogenesis to tumor. All the B products, they talk about this in all of them. They are what's called amphoteric in herbalism, which is normalizing. So, for example, in the herbal world, an herb can be amphoteric to the thyroid gland. It's going to work for hypo and hyperthyroid. It brings it back to normal. It's an herbal term. They don't use the word amphoteric for honey because it's not an herb, but I do because I'm an herbalist and that's how my brain thinks. But what it does is it knows when to stimulate and when to decrease. So it knows it's a tumor, it knows it's bad, it prohibits angiogenesis. It knows it's a wound, it knows it needs to heal, it stimulates angiogenesis. And someday they'll figure out how honey is that brilliant and how herbs are that brilliant. But at this point, we just have to accept that they're way smarter than us and they know how to do that. And honey is one of the products that does. So this is not a typo. It does inhibit angiogenesis in tumors and increase it in wounds. So it modulates oxidative stress. It's a potent antioxidant and free radical scavenger. Again, that's from the phenols. It modulates insulin signaling, which is very important in the tumor pathway, and that would be a 15-minute talk to explain that part. So go ask an oncologist because they could probably do a much better job anyway. Honey modulates proteins, genes, and cytokines that promote cancer. Questions on honey? Yeah.
So how much would you have to take to get these effects? Like if somebody has GERD, how much honey would they have to take? I mean, I don't mean like, I'm not expecting you to know doses.
Right. Yeah, that's funny because some of these I do have dosing in the slides, and so then it wasn't in any of the articles or I would have put it in. But I would say if you're just eating like it's honey, it does have sugars in it. You don't want to, our culture is very much, if we hear something's good, we take it to extremes. I think that most of these products are being used in normal food doses. So if you're using a couple tablespoons a day, you're probably at that point, you know. I think of dosing, like I would think of it as 3 times a day because that's a human herbalist dose, again, the herbalist brain. So I would probably do some sort of soothing tea for GERD with an herbal formula and put honey in it and do a tablespoon in, you know, make it a little bit more honey than just for flavor, like do a tablespoon per cup of tea 3 times a day.
And then just for like general health, maybe like 1 tablespoon a day?
Yeah, 1 or 2. Yep. Yeah. And obviously modulated if somebody has blood sugar issues or anything else, because Greg Tilford was talking about how glycerin is absorbed completely differently. Honey is a sugar, it is absorbed as a sugar. So you want to be mindful of that. So, and for general health, if you do have sugar issues and you don't want to use the honey, we're about to talk about lots of other ways that bee products can help for general health. So, but that was a great question. So I have put the dosing in where they did talk about it, but I can extrapolate on anything else. So next is propolis. Propolis is primarily produced from the resins of trees and other plants. It is used by the hive for construction, repair, and as a protective barrier. In terms of protection, that can be from temperature extremes. Predators like wasps and mites get into hives, and they will actually take a wasp, kill it, and wrap it, mummify it in propolis. If it's too big to remove from the hive, they say it embalms predators. Even mice that get into a beehive, they will embalm in the propolis. It creates an aseptic environment. It's been utilized throughout history by the Egyptians for embalming in the same way that the bees use it. And used by the Greeks and Romans. It was used in London pharmacopoeias in the 17th century and used by Stradivari as violin varnish. That's how he protected his famous violins. It was also used medicinally during World War II. It is composed of resin, wax, essential oils, pollen, vitamins, minerals, and other organic compounds. Its active constituents are phenols, esters, flavonoids. You're going to see phenols and flavonoids a lot in bee products. Terpenes, sterols, aldehydes, and alcohols. CAPE, which is caffeic acid phenethyl ester, is one of propolis's main bioactive compounds, and it's been extensively researched for cancer. The antimicrobial and antioxidant properties are primarily due to the flavonoids, whereas CAPE is both antioxidant and cytotoxic to tumor cells, and we'll talk more about that in a minute. It has antiseptic, antiviral, antibacterial, antifungal, hepatoprotective, neuroprotective, cardioprotective, anti-diabetic, anti-inflammatory, antioxidant, anti-cancer, anti-ulcer, anti-protozoal, hypotensive, and immunomodulatory actions. I'm either going to tell you it's protective to our organs or anti-something bad. Like pretty much that's what I'm going to say to you for the next hour. Okay? So sorry about that, not to be repetitive, but these products are good and do a lot of things, so we need to know about them. Medicinal uses include, again, gastrointestinal disorders, gynecologic diseases, oral disorders, cancer, upper respiratory ailments, and skin diseases. It is used in a variety of health products, foods, and cosmetics. It's used for skin and cosmetics a lot, as a capsule also, extract. It's in mouthwash, throat lozenges, creams or powders, and there are waxless purified forms. Here's a dosage. It is generally non-toxic at human doses of approximately 1.4 mg per kg per day, under a total of 15 grams a day. So even if you're heavy and your dose would be more than that, don't go over 15 grams. Above 15 grams per day for a human, allergic reactions and contact dermatitis have been reported. Again, here's a nice picture of all of its biological actions. So antifungal, this is one of propolis's big uses, as opposed to, all the products are antimicrobial, but like honey is more antibacterial and propolis is more antifungal. Propolis is the bee product with the highest antifungal activity. All yeasts were inhibited by a propolis extract and propolis microparticles, so extractions of the propolis. It also has anti-biofilm properties that decrease resistance to antifungal pharmaceuticals. Is everybody familiar with biofilms at this point? Is there anybody who needs me to explain biofilms? Don't be shy if you do. Okay, everybody's good. It has proven to clear multiple candida species. This is why it's used gynecologically. It's good for a ton of vaginitis. It's also good for oral thrush. So I think we see a lot of candida, also good for ears in animals. It stimulates the fungicidal activity of macrophages. And this study was on vulvovaginal candidiasis, and it was treated with a propolis extract. It inhibited the growth of all Candida albicans strains tested. It caused complete inhibition of growth and death of the strains that were resistant to nystatin, which is the common pharmaceutical used. It showed low toxicity towards human cells, which nystatin is toxic to human cells. And I think this is really important because all the fungal products that we use internally as pharmaceuticals, they're really toxic, right? And they cause a lot of problems. So to have an alternative that actually really works and has scientific proof it really works is kind of awesome to me. It retained its efficacy in a variety of application forms. So topical, this extract, you know, different ways that they used it, and there was nothing they could do to it that made it non-efficacious. It inhibited biofilm formation in 93% of the strains, which made it, again, more efficacious because it could get into the candida easier. And it, again, inhibited biofilm formation in strains where nystatin allowed the biofilm formation. So I think this was a pretty awesome study on how it works. And since we deal with candida, I thought it was a really good one to put in. Oral diseases, I thought this picture of Hello Kitty mouthwash in Japan was just hysterical. So I'm sure you can find it on Amazon. Everything's on Amazon. So if anybody needs Hello Kitty propolis and green tea mouthwash, there you go. It prevents bacteria, plaque development, and periodontal disease. It's effective against 9 anaerobic bacteria that cause dental disease. It has been proven effective in healing oral surgical wounds, so those tooth extractions where you can't close them. I've always used green tea, and there are small issues with that. Green tea works great, but it can cause, like if you put green tea in their water all the time, people complain that the caffeine keeps their animals up, so you have to take it away by mid-afternoon. And some animals have an aversion to the flavor of green tea, so this would be another option for that. And I would always send home for those open sockets green tea and one of those curved syringes to flush up in there. This would be another option to send home a propolis wash to flush up in there. It is less cytotoxic to fibroblasts than chlorhexidine. 3% propolis toothpaste increases the efficacy of preventing gingivitis. And I know I've seen toothpaste at like the health food store that advertise, you know, with propolis. So I think I'm going to start buying them. It cures halitosis. So if you were here in one of my earlier lectures where they were treating camels with halitosis, you could give them propolis. Was that what you just said? Yeah. The camels. We're going to give our camels propolis from now on. Thank you for paying attention. I appreciate that. It is antibacterial and anti-inflammatory to the oral cavity. It affects the microbial cell wall, causing structural and functional damage of the bacteria. And it acts on the modulation of cytokines and other inflammatory enzymes. So everybody run out and get their Hello Kitty propolis and green tea mouthwash. Again, we're going to talk about cancer because propolis and the cape has been so well researched for cancer. The mechanism of action is inhibition of DNA synthesis, induction of apoptosis, activation of macrophages, causing them to produce factors that regulate the functions of B, T, and natural killer cells. It has low to no toxicity against healthy cells. Again, it knows where and when to act. You know, I always think of it like this, like all those dogs that can smell when an epileptic's going to have a seizure or smell a diabetic getting hyperglycemic. You know, there are chemotactic, for lack of a better word, things that we as humans don't appreciate that other things do. And that has to be how these things, or I think has to be how these things know the difference between healthy and unhealthy. There are signals that we don't see or feel or whatever that don't resonate for us, that resonate for things like this. And, you know, two cells next to each other and it knows to go after the cancer cell. It's just so awesome to me. The combination with an adjuvant antioxidant therapy may enhance the effectiveness of chemotherapy by ameliorating the side effects on leukocytes, liver, and kidneys, and consequently enabling dose escalation. So from my understanding of how chemotherapy works, what's dose limiting are the side effects because it is so toxic. And again, toxic to healthy cells because pharmaceuticals aren't as smart as propolis, right? So if we can make the dose before you get side effects higher, we can give more chemotherapy and kill more of the cancer cells while doing less harm to the healthy cells. Propolis with an adjuvant antioxidant like the vitamin C infusions that a lot of people, I don't know if you know Dr. Kendra Pope. She's an herbalist and an oncologist, board certified, and she does a lot of vitamin C infusions as an antioxidant therapy. So mixing that with propolis would allow the more pharmaceutical oncologists to use more chemotherapy. The active anti-tumor constituents include flavonoids, are protective against the toxic effects of chemotherapy and radiation. The cape is the most potent anti-tumor polyphenol in propolis. It inhibits TPA-induced tumor formation. It is cytotoxic, it is anti-metastatic, and it is anti-angiogenic, again, stopping blood flow to the tumors. Artapilin C is cytotoxic to cancer cells, inhibits their growth, and activates the immune system. Propylin C activates mitochondria-mediated cell apoptosis and is a strong antioxidant. Something called PM3 inhibits cell cycle progression and induces apoptosis. Lastly, Kristin, sorry, it's the end of the day, I can't talk anymore, is anti-inflammatory, anti-cancer, and antioxidant. So multiple phytochemicals, multiple mechanisms of action, multiple ways it's fighting cancer. Really, really tons of research on it. Propolis for cancer, more than honey. This would be my go-to. Royal jelly. Any questions on propolis before we get to royal jelly? No, there are studies in the bodies. Mm-hmm. Yep, dosing humans. Yep, and I think there are probably some rat studies too. So, yes. Mike?
So, when you collect this from your hives, I know you play with it. Is it like a hard blanket?
You can feel it. Somebody asked what propolis feels like.
My question is.
So it's gummy. It's thicker than wax. It's like harder than wax. Yeah, that's what you would do is you would make a tincture out of the propolis. You would need to use Everclear. It's a resin. So as a plant, as a processed, I mean, the way you think of this is, for me, the way I think of this is an extension of my herbalism. The bees are doing the first level of processing from the plants. So just like I would make a tincture or a tea or something straight out of the plant, they're making these products. You can eat propolis straight, chew on it, get the nutrients out of it. I guess if it got too waxy, you could use it like gum where you've chewed everything out of it and spit the waxy part out. But if you were going to make a tincture out of it, you would have to use Everclear because it is the resins of the plants and you're not going to extract unless you use Everclear.
So I bought some from a beekeeper.
Okay.
And it's one of the beekeepers at the farmer's market. And of course, this is the best in the state. Or this is the best honey in the state.
So you made sure this propolis you bought was organic though, right? Or he said it was organic when you bought it.
He said he made it up himself from his hives, and he made it in a liquid. I guess it's a tincture form, so I can see it as alcohol. So there's no quality control there. He didn't measure 3 grams per 100 to get his 3% or whatever. So, but he swears that's all his family uses for colds and stuff like that.
Absolutely, it would be good for colds. Like a tincture of it is good for all kinds of things. It enhances health.
When she gets a sore throat, she doesn't get sore throats anymore. Do you use that in your family?
We're about to, now that I wrote this talk. Yes, we are going to use it in my family. So, yes. And actually, so my son's bee mentor made me give him this talk as trade for helping my son get all the products for me. And he's like, I'm going to start, he has cancer, he has tons of melanoma and things that are taken off his skin all the time, and he's smoked for 100 years. He's actually like the poster child for where my children will never smoke because he says he can't quit. He's the sweetest man. But he heard this talk and he's like, I'm going to eat propolis every day. I'm taking it out of my hive. I'm chewing it. He wants to live. He has will to live. And he is going to start, I'm going to cry. He's going to start eating propolis all the time. He doesn't care. He also does, we're going to get to bee venom acupuncture. And when I gave this talk to my son, he's like, Mom, Paul's been doing this in front of me forever. And he knows how to do it without killing the bees, to sting himself in the right places. And so we talked about acupuncture points, but we'll get to that in Venom. But but he's going to start eating propolis. But yes, I mean, a tincture in Everclear is going to be icky too. It's going to taste icky, but eating it's going to be bitter. But if you've got cancer and you want to live, you're going to deal with that.
Would you put this right on the tune on the dog?
No, it's oral. You would want to use it orally, not topically.
You don't do it topically?
No, you use it orally. So. Yes.
Correct me if I'm wrong, but I thought you couldn't get organic honey or propolis because you can't control where the bees pollinate.
So the question was about how you know it's organic,
How can you certify it?
how you would certify it organic. I guess technically it would be hard to certify organic, but like I live in the middle of 72 acres, as anybody who's been in here has heard 4 times today. I live smack dab in the middle. Bees travel about a mile, but they won't travel any farther than they have to. So it's the same thing as how do you know when you're getting clover honey that it's all in clover, because they're in the middle of that field. That's their local, you can't say anything's 100%, but one has to assume that if you present them with an organic field of clover or buckwheat or whatever, they're not going to bother to travel. They're not going to work any harder than they have to. They're not going to go looking for the Roundup, whatever 3 fields over when they've got a field full right in front of them. So I don't know about certification. I don't technically worry about certification, but I would not be buying it. There's a farm stand down the street from me, and they brag about the chemicals they put on their strawberries and all their plants, and I don't eat any of their food. But, I would not be buying their honey. But I feel very safe eating the honey on my farm. That I don't know what my neighbors do, but I'm in the middle of 72 acres, so I think my bees stay local. So, my deer too, because they know they're protected. Hunting season, I have more deer. So they know where it's safe. So animals, again, are smart. Other questions on propolis? Propolis is my new favorite product. Royal jelly. Royal jelly is a form of hypopharyngeal and mandibular gland secretion from 6 to 12-day-old worker bees. Again, certain ages do certain things. From 6 to 12 days, they are making royal jelly. It is a superfood that is solely consumed by the queen bee. Royal jelly is also fed to the honeybee larvae upon hatching and helps them to nurture the brood, which is, again, the food. For the first 2 to 3 days, royal jelly is the only food given to all the young larvae in their maturation process, while for the queen, it is a specific food for her whole life period. And that's how you have a queen who is fertile versus the sterile worker bees, is the queen eats this royal jelly. The constituents being different than the brood that the other bees eat is what causes the sterility versus the fertility. It also causes her to live longer, and we're gonna, which is the next sentence, and we're gonna talk about how it enhances life, because people in the same way. This is all zoo pharmacognosy, right? We've watched the bees use these products for these things, like the embalming with the propolis. You know, here we have the queen lives longer, so eat it, you'll live longer. And so there's studies about all of that. So royal lactin in the queen bee triggers an epidermal growth factor receptor mediated signaling pathway, increasing body size and ovary development. So that's the part of it that is working for the queen bee. It contains water, proteins, carbohydrates, lipids, amino acids, enzymes, hormones, vitamins, and minerals. Royal lactin, again, is the most active, bioactive protein in the jelly. There are other biocompounds, including HAD, fatty acids, esters, AMP, N1 oxide, adenosine, acetylcholine, polyphenols, and hormones. The biological activities of royal jelly are mainly attributed to the bioactive fatty acids, proteins, and phenolic compounds. It is antibacterial, anti-allergy, anti-inflammatory, antioxidant, anti-aging, neurotropic, which means it supports the nerve system, hypoglycemic, hypocholesteremic, hepatoprotective, hypotensive, vasodilative, and it has I really can't talk, I'm sorry, immunomodulatory actions. Its medical uses include reproductive health. Again, it has the hormones in it, and it is supporting the fertility of the queen, so it supports fertility. We're going to talk about that. Neurodegenerative diseases, aging disorders, and wounds. It also increases growth rate of healthy tissue, yet controls tumor growth and metastasis. We're not going to talk about royal jelly for cancer. I could have talked about every part of the bee for cancer, but I thought I should give you some different properties, different uses of different ones, but every single part, every single product from a bee is anti-carcinogenic, or anti-cancer. It is used in pharmaceuticals, foods, cosmetics, and manufacturing. This one does have a significant allergic reaction side effect. These allergic reactions may vary from minor disorders such as light gastrointestinal problems or atopes to severe reactions. Severe reactions include asthma, anaphylactic shock, intestinal bleeding, and even death. The risk of developing an allergy to royal jelly is greater in individuals who have other allergies or strong allergies to other bee products. Individuals allergic to pollen, honey, or venom should not orally ingest royal jelly. In patients with bronchial asthma, royal jelly should not be taken during an asthmatic attack. I don't know who would start eating royal jelly while they're in the middle of an asthma attack, but that's just me. Topical applications of royal jelly can cause skin rashes and eczemas. So it is a concern, use a little and make sure it's safe before you use a lot. Another big concern with royal jelly is quality and adulteration. We did organoleptics in the last hour as quality assurance, and it's the best assessment of a product short of chemical analysis. It should always be sold frozen. If it's not frozen, it is of no use to you. It should be a whitish yellow with a pungent odor and a sweet and sour flavor. However, if it is adulterated, it's usually mixed with honey. So you're not going to get something terrible. You're just not going to get as strong a royal jelly as you want. That increases the sugar content while decreasing the protein and the lipid content. And it is used extensively as a cosmetic or dietary supplement. And here's the last slide from that common license article of the activity of royal jelly. So we're going to talk about its hormonal effects. It has female, I have 5 minutes left. So I'm going to go way over. Y'all are welcome to leave. This was like a 3-hour talk that I tried to make an hour and clearly didn't do a good job of. It's the end of the day. I will not be offended if anyone leaves, but if you want to hear the rest of this lecture, I'm totally prepared to stay and give it all to you. So, but don't be shy about leaving if you want to. Sorry, I really tried to cut this. Obviously not enough. But it has female and male reproductive effects. Female first. It stimulates fertility and improves libido. It reduces premenstrual syndrome symptoms. It improves the quality of life of postmenopausal women. It relieves perimenopausal symptoms by rebalancing the circulating hormone levels. It decreases FSH while increasing estrogen. It has a positive effect on osteoporosis. It increases bone calcium levels and bone mass. It increases ovulation numbers in older females. It increases the ovulatory hormones again. Before it decreased FSH, now it increases FSH and LH. This particular compound in it improves hormonal regulation, prevents follicle depletion, and enhances synthesis of ovulatory hormones. It is similar to the effects found with the equine chorionic gonadotropin, which I know people have a lot of ethical issues with, so this would be an alternative. It induces estrus, improves gestation, and improved parturition rates. For males, it contains spermatogenesis stimulating compounds. It again improves fertility and libido. It increases testosterone levels. It increases semen output and improves quality, because remember, semen is more than just sperm. It's all the fluids from all the accessory sex organs. It decreases oxidative injuries in the testes. It decreases the number of dead and abnormal sperm. So you remember in vet school, in repro, we had to look at, sperm and see how many were swimming and how many were swimming normally and how many were dead. This will make more of the healthy ones. It treats asthenozoospermia, which is reduced mobility or immobile sperm. And this is in a dose-dependent manner. And in a study on rabbit fertility, evidently when rabbits get too hot, they become less fertile. So, there's the expression, be like rabbits, so I don't know why you'd want to increase their fertility. But were you a breeder who wanted to increase rabbit fertility, you could use royal jelly. It improved their libido in these ones that had become uninterested. It improved their semen quality, their sperm output, their circulating testosterone levels, and their fertility. And in a study on aging hamster testicular function, it decreased histological degeneration of the testes, such as atrophy and diminishment and detachment of cells. It decreased decline in intratesticular testosterone levels, decreased the loss of Leydig cells, and increased the number of tubules performing spermatogenesis. So it has quite a lot of reproductive effects. Aging and cognition. This is from Australia, this product here, this picture. It is believed from ancient times that royal jelly can prolong life through a similar effect as one that provides a longer life of queens than the worker bees. It stimulates physical and mental functions for the elderly and increases their appetite and weight. It has traditionally been known to improve memory, prevent senility, increase energy, reduce anxiety, and calm hyperactive subjects. It is neuroprotective to the hippocampus. It is an anabolic stimulant, restores homeostasis, increases physical energy and mental activity, increases muscular capacity and respiratory function, and improves appetite. Dermatologic effects. It is antioxidant, antibacterial, anti-inflammatory, and wound healing effects make it as an ideal component of cosmetics and skincare products. It shortens the healing time of desquamated skin lesions, which is anytime the skin is peeling or we've lost the layers, like road rashy kind of thing. It increases vasodilation to wounds, so it increases their blood flow. It has antimicrobial properties that prevent infection in wounds. It suppresses the secretion of pro-inflammatory cytokines. It has exhibited protective action on human skin against ultraviolet B-induced photoaging by promoting collagen production. So it's good for protecting against UV damage. Questions on royal jelly? Yeah?
So you said it all needs to be frozen, but the picture you showed was like capsules.
Yeah, it's a product. It's not, I'm not supporting this product. It was just a picture I found because it was cute. I would only use it fresh and frozen, like it would come in a jar like that. Frozen, yes.
Do you know how you would dose a mare who has reproductive issues?
I do not know how we would dose a mare that has a reproductive issues. I would go back to, did my first slide on this one have dosing? I'm not sure it did. Yeah, I would do it like honey, start with a little bit, and especially due to the allergies, I would start with a small amount, like a teaspoon for a mare, and just build it up until you see the effects you want to see. Sorry that I'm going over. There was just no way to cut any more of this, so, but we'll try to get through the rest of this. And again, feel free to leave. Each bee pollen, so we're in bee pollen now, pellet contains over 2 million flower pollen grains. So I passed around that bee pollen. Each one of those has over 2 million flower pollen grains. When collecting pollen, I think we all know this, bees are not only gathering food for their young, but pollinating other plants so they grow. The bees use bee pollen as food for the young. They make that brood, that bee bread. It is considered one of nature's most completely nourishing foods. It contains nearly all nutrients required by humans. It contains all the essential components of life. It is composed of protein, free amino acids, enzymes, cellulose, fiber, vitamins, minerals, RNA, and DNA. It has more protein per weight than any animal source. So you get more protein from one bee pollen than, if you ate a steak's worth, you would get like an unbelievable amount of protein. It is the most dense form of protein that there is. And the exact chemical composition has yet to be elucidated in a laboratory setting. I don't know how they would ever elucidate it because every bee pollen's going to be from different plants, so they're going to have different chemical constituents. It is used in traditional Chinese medicine as a nutritive tonic. It is used medicinally for physical and mental endurance, vitality, longevity, recovery from illness, blood building, prevention of disease, cardiovascular support, protection from radiation and cancer. It inhibits the development of harmful bacteria. It normalizes, again, this normalization, cholesterol and triglyceride levels, as well as other metabolic conditions. It regulates intestinal function by a high amount of cellulose and fiber. It stimulates ovarian function, prevents prostate disorders, and treats allergic conditions via desensitization. It also is good for gastrointestinal ulcers, headaches, upper respiratory diseases, and urinary tract disorders. It contains lecithin, which aids in adipose reduction. Phenylalanine, which is an appetite suppressant. It enhances the immune system, corrects body chemistry, and therefore clears the body of toxins, including heavy metals, which in turn can help prevent cravings in people going through withdrawal from alcohol and drugs. Due to the DNA and RNA in it, used either internally or externally, it helps the skin look and remain healthy, and it suppresses acne. Dosage. Should be slowly built up over 1 to 2 weeks to a maximum of a teaspoonful per day for allergies or a tablespoonful per day for other indications. It is most effective when taken with food, fruit, or fruit juice. I can say I take bee pollen, and I did. I went off it for a while because I wasn't home or whatever, and I came home and I took my tablespoon, and I felt weird for like a few hours afterwards, going from nothing to a full tablespoonful. But when I had first originally titrated myself up, I never felt weird on it. But I think it's because I detoxed too much too fast, especially after traveling. So need to make sure there's no anaphylaxis. Take 1 pellet first and then start building up. Now, it is the perfect nutrition. It has all of these things in it. 22 amino acids. Vitamins are mostly B, C, and E. Minerals include calcium, copper, iron, magnesium, manganese, phosphorus, potassium, silicon, sulfur, and 59 other trace minerals. The carotenoids are converted into vitamin A, and it has 45 calories per tablespoon, so you're getting more bang for your buck than in anything else. It has more protein than any other food source. It is the richest source of vitamins in a single natural food, and it's low calorie. It also enhances probiotic viability, so it is the perfect nutrition. Allergies and asthma. It lowers the body's sensitivity to allergens and lowers histamine levels. Antioxidants in bee pollen are anti-inflammatory to the lungs. It must be taken 6 weeks prior to allergy season throughout the entire season for allergies. Flavonoids in bee pollen and bee pollen as a whole prevent immediate type allergic reactions by inhibiting mast cell activation and degranulation. That's the anaphylactic type thing. It prevents IgE-mediated allergic reactions by preventing IgE complex formation and affecting binding of the complex to the receptor. It also inhibits histamine secretion. And I think that's it on that. So, and this is the homeopathic theory of take small amounts to desensitize the body, and that's why you're starting 6 weeks prior to allergy season and building it in.
If you started there already, then the problem, it won't work.
It won't work as well, yeah, because it's going to take that time. It's really a preventative, not a treatment for allergy desensitization. Weight control. This says weight loss in the slide, but it's really weight control. It works wonders for weight control or weight stabilization regimen by correcting possible chemical imbalance and body metabolism that may be involved in either weight gain or loss. It has enzymes that enhance digestion. It speeds digestive combustion, causing the body to burn fat and calories faster. The lecithin in bee pollen dissolves and flushes body fat. It lowers LDLs while increasing HDLs. It eliminates cravings. The phenylalanine is an amino acid in bee pollen that affects the appetite center to signal fullness or hunger. It is particularly favorable for older individuals who may have difficulty in recovering from a malnourished state. A diet enriched in protein-rich bee pollen is suitable for children with a lack of appetite, beneficial for patients after surgery, beneficial for people undertaking hard physical and mental work. It results in strengthening muscle function while increasing body mass for athletes. But I think the most interesting thing is that it affects the appetite center. So again, it's amphoteric. It will tell you to either gain weight or lose weight. Okay, last thing, bee venom. We're going to run through this. Thank you guys. I'm glad you're interested enough to stay. And again, if you need to go, feel free. So bee venom's biologic purpose is to protect bees from their enemies. It is only produced by the queen and the worker bees, the female bees, as the stinger and venom are evolved from the egg-laying apparatus. It has a long history of traditional medicinal use. Alexander the Great used bee venom therapy for hip pain. It contains all these things that I'm not going to go through all of. 5 bioactive enzymes. The phospholipase A2 destroys cells by breaking down the cell membrane. Phospholipase B specifically breaks down blood cells. Hyaluronase breaks down hyaluronic acid. And acid phosphatase triggers basophilic histamine release. Alpha glucosidase is involved in honey production. But PLA2, those are the bad effects. That's what it does when it stings you. PLA2 has protective effects against a wide range of diseases, including arthritis, asthma, Parkinson's, drug-induced organ inflammation. Melittin, which is a peptide and the main component of bee venom, is cytotoxic to cancer cells and anti-inflammatory and antimicrobial. Apamin, another peptide, is also cytotoxic to cancer cells and has nociceptive activity. Adolapin is anti-inflammatory, antipyretic, and analgesic. And MCD, which is mast cell degranulating peptide, is anti-allergic. So melittin also enhances activity of PLA2, phospholipase 2, disrupts cell membranes, causes cortisol release. Apamin increases cortisol secretion. It's a neurotoxin. It crosses the blood-brain barrier, which is very important in how it works for neurodegenerative diseases. It induces hyperexcitability. It irreversibly blocks calcium-activated potassium channels. That will be important in a future slide. It's nociceptive. Adolapin blocks cyclooxygenase, inhibits PLA2 and lipoxygenase in platelets. The MCD releases low concentrations of histamine. It inhibits mast cell degranulation and interacts with IgE molecules, which is how it works in allergies. So it has, bee venom as a whole, has anti-inflammatory, antibacterial, radioprotective, anti-cancer, anti-nociceptive, hepatoprotective, and immunostimulating actions, used for many inflammatory conditions such as arthritis, joint disease, Lyme disease, rheumatoid arthritis, multiple sclerosis, and more. Can be used to treat epilepsy, chronic pain, coagulopathies, migraines, neuralgias, cancers, wounds, asthma, keratinoconjunctivitis. And it has been proven very effective in the treatment of a variety of neurodegenerative diseases. I have a slide on that. The best method of therapy is to use live bees to directly sting the patient. And so if you want to do that without killing the bee, you actually have to hold the bee and insert the stinger and then pull the whole bee with the stinger out very slowly and very gently, and you can actually keep the bee alive. But you have to be a really experienced bee handler to do that. Again, my son's bee mentor is, and my son is now that he's heard this presentation, learning to do that. But you have to really know, you have to hold the bee, because if the bee flies off, it's going to detach and the bee's going to die. So where they do this, people who know how to do this actually have to handle the bee to do this. And you have to handle it gently enough you don't hurt its wings and everything else. So this is an art, right? For the rest of us, for us doctors, bee venom can be collected and used as an injection, either locally or through apipuncture, which is where bee venom is injected into an acupuncture point. It is used in homeopathic tablets, creams, liniments, and ointments. A lot of the research shows, and we're going to talk about it as acupuncture, that that's the best way to do it. Erythema, heat, swelling, and itchiness are expected from bee venom, but allergic reactions range from an overly large swelling to hives and throat swelling, even anaphylaxis and death. I think most of us know that. Patients who show signs of allergic reaction should not receive bee venom therapy unless first undergoing desensitization. I think this is pretty common sense for us. And all patients should be tested first if they've never been stung by a bee before. So this, I think, is really important. The LD dose of bee venom for a human is 2.8 mg of venom per kg, which translates to roughly 650 stings for a 150-pound person. So, I mean, unless you're really being chased by a swarm of African bees, you're not going to be stung to death. Okay.
Is bee venom the same across all the species?
This is honeybee venom. This is all honeybee venom. I can't speak to other species. All my research is in honeybee venom specifically. That's a great question. So apipuncture, bee venom acupuncture. It is both anti-nociceptive and anti-inflammatory. The anti-pain effects are due to the synergy of acupoint stimulation with the medicinal effects of the bee venom. And all these studies that I'm having here, they either did them as dry acupuncture alongside it or bee venom in non-acupuncture points, and either which way you did it, doing apipuncture was the most effective way of doing it. So one of the things I did with my son's bee mentor is, he has lower back pain, is show him a few simple acupuncture points and tell him to sting, instead of just stinging the trigger points in the lower back, to do like bladder 40 or stomach 36 or some of those points, you know, simple points that he could do on himself that would be more effective according to all this research. So, and I'm going to try to gloss over some of this. It reduces visceral nociceptive effects, mechanical and thermal hypoplasia, and arthritic pain. We're not going to go through all the pathways. This one I thought was really important. In a study on dogs with thoracolumbar IVDD, bee venom injections at acupoints substantially improved the myelopathy scoring scale, the functional numeric scale scores of canines with moderate to severe IVDD. The bee venom apipuncture reduced the repair time of canines with moderate to severe IVDD, suggesting that they are an effective form of therapy. Bee venom injections at acupoints exert a therapeutic effects on canines with severe IVDD, and it reversed 100% of cases of mild IVDD in canines. So that's kind of huge, right? Humans with chronic low back pain, the results showed that apipuncture was effective in the release of bothersomeness, pain intensity, and functional status and quality of life. And so they did the study for 3 weeks, and it lasted another 9. So it lasted a total of 12 weeks from 3 weeks of apipuncture. So it increases IL-10 expression in the first 6 hours post-treatment, and reduces IL-6 in the first 24 hours post-treatment in spinal cord compression injuries. The use of apipuncture at stomach 36 and GV3 post-injury promoted partial functional recovery of the hind limbs and a decrease in the lesion size after spinal cord injury. Bladder 23 decreased proteolytic enzyme activity. ROS induced oxidative damage to synovial fluid proteins and was anti-inflammatory to joints. GB34 decreased the number of white blood cells, infiltration of leukocytes and fibroblasts into the joints, and the level of variety of pro-inflammatory molecules. I have all the biochemistry of this, but we're just going to get through these last 2 slides. In general, BV treats neurodegenerative diseases by modulating immune cells in the periphery and glial cells and neurons in the CNS. It has been used to treat Parkinson's, multiple sclerosis, Alzheimer's, and ALS. It suppresses microganglial activation, and microganglial activation leads to neuronal cell death, and it's triggered in neurodegenerative diseases. It is neuroprotective. Bee venom administration prevented the loss of dopaminergic neutrons in the striatum and substantia nigra, increased striatal dopamine levels, suppressed neuroinflammatory responses, suppressed microganglial activation again, normalized neuroinflammatory and apoptotic markers, restored brain neurochemistry, and reduced the production of pro-inflammatory cytokines. In multiple sclerosis, bee venom decreased functional debilitation. In ALS, improved motor activity, prolonged lifespan, and since that's a very life-limiting disease, that's a big deal. Reduced levels of cytokines released by microglia and astrocytes, prevented mitochondrial dysfunction, activated cell survival pathways, improved walking ability, decreased neuroinflammatory protein levels in the spinal cord, reduced the number of misfolded SOD1, which is a big thing in ALS, and restored the ubiquitin proteasome system. The melatonin inhibits apoptotic factor and therefore cell death in neuroblastoma cells, reduces non-inflammatory mediators and cytokines to suppress microganglia, and the apamin irreversibly blocks those sodium-potassium channels that control the firing frequency of neurons and causes hyperpolarization of action potentials, protecting nigral dopaminergic neurons, increasing striatal dopaminergic levels in nerve terminals, and has neurorestorative activity. Atopic dermatitis, something we see a lot of as veterinarians, right? It has multiple influences on cells involved in allergic conditions. This was one of my technician's dog that had atopic dermatitis. In a study of dust mite-induced atopic dermatitis, this is why I was like, dogs, gotta tell you guys this. The phospholipase 2 from bee venom suppressed skin lesions, reduced Th1 and Th2 cytokine levels, reduced serum IgE levels, decreased dermal and epidermal hyperplasia, decreased epidermal lymphocyte infiltration, and decreased mast cell accumulation. In another study on atopic dermatitis, it was demonstrated that bee venom effectively suppressed the onset of atopic skin lesions, inhibited cytokines that are influential in atopic dermatitis via decline of IgE, TNF-alpha, and TSLP in vivo, and demonstrated effective anti-inflammatory activity. And that's it. Thank you guys for staying. I'm sorry I went so far over. I really tried to make it short. I will totally take questions up front. I know I stopped taking questions because we were running so over, but I will totally take questions up front.
Finding your visibility in today's climate with website creation, hosting, SEO and social media management, telephone greetings and VoIP services, and online video production.